Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about decreasing thigh pain after knee replacement surgery. Before I jump into that, hit that subscribe button if you're interested in all things related to knee replacement surgery, preparation, recovery, and much more. So in this video in particular, I'm going to talk about pain in the thigh muscles. So obviously the big muscles of your quadriceps, the big muscles in the front and kind of the side part of your thigh. Also, you have your hamstrings that may be a little sore and painful after surgery, and that's the back part of your thigh. And there's muscles on the sides as well, and in the middle or medial part, a lot of your adductor muscles, we call them. And there's multiple factors, multiple reasons why you might have some achiness, pain, discomfort in the thigh itself. Again, we're kind of differentiating this from pain in the muscles in the thigh rather than, of course you're going to have also some pain and stiffness in the actual knee joint. But this can be a lot of different reasons. So muscle weakness and muscle inhibition after surgery is extremely prevalent. Probably almost 100% of people are going to have some weakness, some decreased muscle contraction and strength after surgery. And this can be due to inflammation as well as just some of the traumas of surgery itself. So that's one reason. The inflammation and the swelling is going to cause some discomfort, some achiness, some tightness, some stiffness, feeling of heaviness. So there's the inflammation. There's your increased sensitivity of the nerves and your nervous system. Just like there's increased sensitivity of all the nerves going to the knee joint itself. This also can be going on in the thigh, in the muscles of the thigh as well. So what can we do about that to relieve this pain and discomfort? So here's just a handful of different strategies. There's no one size fits all really. It's kind of finding the thing that is most helpful and most beneficial and pain relieving for you. And with a lot of people, it's a combination of things. So first of all is heat or ice, or heat and ice. So early on after surgery, obviously you're doing a lot of icing the vast majority of times. There's a lot of videos I've done about icing, so I won't get too much into it. But when you ice, you can ice at the knee joint, but feel free, put that ice up higher as well. Put some ice right on your thigh, right on the upper part of your leg as well. And that will have pain relieving benefits and help decrease inflammation just as much as it helps at the knee joint itself. Also, I talk about heat in some other videos. Heat is okay to use after knee replacement surgery. A lot of people find it really beneficial. Actually, it may be more so beneficial putting it on the thigh, putting it on that soft tissue, on those muscle bellies, because that's going to help kind of calm down and relax the muscles. You want to think about when you take a nice hot shower, how good that feels. Same thing with putting some heat up on the upper thigh, where you might have some achiness and discomfort. Some other techniques I like to use are elevation. So getting that leg up, elevated high, helping to bring some of that swelling and fluid out of the knee, out of the leg itself. It's important when you do elevation to get the most benefit. You want the leg really up high, maybe 30, at least 30, 45 degrees above the level of the heart. A lot of times you see people sitting in the recliner and maybe they have a pillow under the leg, but really the leg, the level of their heart and their chest is still higher than the leg itself. So you're not really getting the benefits of the elevation by sitting in a recliner. It's a lot better if you're laying down on your bed or on a sofa or something and propping it up with a lot of pillows or bolsters and things like that. Some other things you can do is massage. So real easy way to, again, bring some blood flow to the muscles, calm them down, relax those muscles. I like to do it, do a little bit of heat and then do some massage right after the heat when there's, a lot of blood flow, a lot of relaxation in the muscles already. You can do this by yourself. I use, a little dowel and rub it up and down. I've seen, Tony Maritato, he uses the rolling pin. He loves the rolling pin. You can use a lacrosse ball. You can just use your hands and some lotion and some cream and just rub your hands in different places. Or maybe get a family member, get your spouse, get a good friend to help do some massaging to the achy and sore muscles of the thigh. And one of probably my favorite things to do are, as a physical therapist, are exercise related. So doing some light contractions, so squeezing that quadricep muscle, doing some quad sets, either laying down or seated, just squeezing that muscle tight, hold it for 5-10 seconds and relax. That can have some good pain relieving benefits. Maybe do 5 to 10 repetitions of that. You can also just do some knee extension, so extending the knee and bringing it back down. So you can do that sitting in a chair, right? Just bringing the foot up, extending the knee, and then bringing it down nice and slowly. Again, those muscle contractions, that's going to bring some blood flow, some fluid to the area, and just have some pain relieving effects, decrease some of that sensitization of the nerves. And the same thing can potentially be beneficial as with stretching. So stretching can be difficult after surgery, obviously, with a lot of pain and discomfort. It's hard to get into a position where you really feel that stretch. But, incorporating some stretches, one of my favorites is laying on your belly and using, a strap or a towel and bringing that heel up toward your bottom. So bending your knee, bringing your heel toward your bottom, and feeling that gentle, moderate stretch in the front of your thigh, in your hip flexors, and everywhere else. So those are some of the great ways. And then the last one I have here is just getting up and moving your body. Sometimes when we're not moving for a long time, either at night when we're sleeping or when you're sitting in a chair for a long time or a long car ride, the muscles aren't getting as much blood flow. There's, this kind of stagnation of the fluid and the swelling and inflammation. So get up and moving, that's going to help with muscle contraction. It's going to help move some of that fluid out that we want to move out. It's also going to bring blood flow, new blood flow with oxygenated blood, so bringing oxygen and nutrients to the muscles, and that can really be a pain relieving benefit as well. So just a quick rundown, we said icing or heating, massage, elevating the leg, gentle contractions, muscle contractions, exercises, gentle stretches, and just getting up and walking and moving. So I hope you found this video helpful and insightful. Please be sure to hit that like button if you did, so I can spread this video to other viewers. Please be sure to leave your comments, your questions, your suggestions, your personal stories, anything else below, and I'll do my best to get back to you. Thank you very much for watching.